Well, cases of colorectal cancer are on the rise. It is estimated to be the deadliest cancer for adults between the ages of 20 and 49 by the year 2030. So a mother I met was diagnosed with the disease at the young age of just 34 years old. Now she is urging others her age to take your health seriously before it's too late. In between her middle school literature lesson plans and raising two kids at home, Janessa Schwartz wasn't feeling quite right.
Really chronic fatigue, inconsistent bowel habits, and all of my symptoms were easily explained away by just being a tired working mom.
A friend told her to get checked out by a doctor just in case. And Janessa's story took an unexpected twist when she got a colonoscopy.
And told me I had a tumor blocking my colon and that she couldn't complete the colonoscopy.
Janessa was only 34 years old when her life was forever changed.
And that's when I was told that I had stage 4 colon cancer. So I was given 18 months in the beginning. And all I could think about was what I'd miss. All their graduations, their eventual weddings, and the little things too.
Now at 40, she has beat the odds from her original diagnosis, but every day continues to be a challenge.
I'm teaching full time, and I find it harder and harder to kind of get through the days. You know, I get to about lunchtime and I look at the couch in my classroom. I'm like, oh, that looks tempting.
There has been an alarming rise in colon cancer rates when it comes to millennials and those younger than that.
Physicians are aware, primary care doctors are aware, and oncologists are aware. I'm not sure the public is still aware that it's a real issue.
Health experts have not been able to pinpoint exactly why there are more people of younger ages getting diagnosed with colorectal cancer, but they do point to concerns about lifestyle practices.
Physical activity, obesity, sedentary lifestyle, we know those are risk factors for colorectal cancer in general. And then diet, colorectal cancer, unlike most other tumors, is particularly sensitive to the diet or dietary changes. The Western dietary pattern, a diet high in fat, meat, and sweets, is not a good diet for colorectal cancer risk.
The American Cancer Society says colorectal cancer in younger people has doubled since 1995, with new cases rising by 2% annually for people younger than 50. What makes it difficult is that regular screening starts at the age of 45. Younger than that, Dr. Zell says if you notice anything suspicious, anything, you must go talk to your doctor.
Unfortunately, young onset or early onset colorectal cancer is hallmarked by unusual symptoms like fatigue, sleep disturbances, and that makes it very hard to diagnose.
I wasn't paying attention to my body. I wasn't listening to it. I wasn't looking out for symptoms. I'm not even sure I had ever even consciously recognized colon cancer as like a thing. You know, I'm sure that I had, but it never crossed my mind.
The reality of colon cancer is that it's a deadly disease when caught late. It's a curable disease when caught early. Dr. Zell says 92% of colorectal cancer can be cured if it is caught early. And Janessa wants everyone to take her advice, to pay attention to what is going on with your body, not only for you, but the ones you love too.
My daughter is in a play right now. It's her very first play. And I just, my desire, my drive to just be there for them, for these moments, really just kind of gets me up every morning.
Janessa has had more than 100 chemo treatments since she received her diagnosis. The cancer has continued to spread through her body, and she is holding on strong and cherishing every moment she can. And when I talked to Janessa, she claimed the Colorectal Cancer Alliance helped prolong her life with other methods of treatment. Now, this organization provides support for patients and families, raises awareness of preventative measures, and fundraises for critical research.